So the causative agent for tuberculosis is the bacteria Mycobacterium tuberculosis. So some characteristics of that would be that it's an obligate aerobe and rod-shaped. Something that's kind of unique to Mycobacterium tuberculosis is that it is both considered gram-positive and gram-negative within the scientific community. It's kind of debated due to different qualities about it. So it's often termed a gram ghost, as it's difficult to be seen with some staining because it has an irregular form of cell wall. So the cell wall has peptidoglycan, but it also has an irregularly high number of glycolipids, which makes them acid fast, meaning that they're difficult to stain. Based solely on gene sequencing and DNA, it's closely related ancestrally to being gram-negative derived, but typically it's considered more gram-positive due to that structure of the cell wall. So the causative agent for
the signs and symptoms of tuberculosis, they can actually start showing up at various times depending on the situation. So it can occur in the first couple of weeks after getting the infection, or it actually could take up to years later for the signs to actually show, depending on when you got infected and how your body reacts to it. Some of the signs and symptoms include coughing that lasts up for 3 or more weeks. You can cough up blood. You can have chest pain or pain with breathing and you're coughing. Unintentional weight loss, fatigue, fever, night sweats, chills, loss of appetite. But tuberculosis can also affect other parts of your bodies, not just your lungs, including your kidneys, your spine, or your brain. And when it occurs outside of your lungs, signs and symptoms are going to vary according to the organs involved. For example, if you had tuberculosis in your spine, it may give you back pain, and tuberculosis in your kidneys might cause blood in your urine. So it really all depends on the type of the disease that you have. So for the signs and symptoms,
tuberculosis is a contagious disease that is acquired through someone that is untreated, coughing, sneezing, spitting, laughing, or even singing. This is because the disease enters the body when the microscopic bacterial droplets are released into the air and then inhaled into the lungs. While it is contagious, it is hard to catch. Someone with HIV is much more likely to acquire the disease because they have a weakened immune system. This also includes any individual with a weakened immune system. There are some environmental factors related to the disease that puts the individual more at risk. This includes living in overcrowded areas, areas with little medical care, or in areas that the rates of TB and drug-resistant TB are higher. These areas include Africa, Eastern Europe, Asia, Russia, Latin America, and the Caribbean islands. Indoor air pollution, tobacco smoke, and working in a healthcare facility also puts you more at risk. Tuberculosis is a contagious. There are a few steps to diagnosing tuberculosis. Initially, you will have a tuberculosis skin test or a blood test done, and this will prove an individual is infected with the tuberculosis bacteria. A positive result does not mean that they have the tuberculosis disease. To diagnose someone with tuberculosis, a chest x-ray or sample of sputum must be taken and the results be positive to diagnose the tuberculosis disease. After this test, the individual is either diagnosed with latent tuberculosis infection, which means that they have the bacteria but are not contagious, or that they have active tuberculosis, meaning that they have the disease. There are a few steps to diagnosing.
So, fun facts: 1/4 of the world's population is actually infected with tuberculosis. However, there is 2 different types of tuberculosis. There is latent tuberculosis and active tuberculosis. And with the latent one in this condition, you can have a tuberculosis infection, but the bacteria can remain in your body in an inactive state and it causes no symptoms. So it isn't contagious and it doesn't really give you symptoms. However, it can turn into active tuberculosis later on in life. And then the second thing is that 2 out of 3 cases of tuberculosis actually occur among foreign-born people. There is a very increased number of it in Africa, and one of the reasons for that is that there is a link between the spread of HIV which is the virus that causes AIDS and tuberculosis, and because of the conditions that they live in there, it can be more prominent in countries like that don't have the sort of medical attention.
Without treatment, tuberculosis can be fatal. The World Health Organization estimates that 1.8 billion of the world's population is infected with TB. Last year, 10 million people became ill from the disease and 1.6 million people died. After getting a TB test, you will have to get a chest x-ray or a sputum test to confirm these findings further. There's an active and a latent tuberculosis, and if you have active tuberculosis, treatment includes taking antibiotics for at least 6 to 9 months. The exact medication and length of your treatment depends on your age, overall health, drug resistance, and infection location in the body. If you have latent tuberculosis, which is tuberculosis that shows no signs or symptoms, it is important to get preventative treatment. Isoniazid is a drug used to prevent latent TB from progressing to active TB. It is an affordable drug, and it is mainly used to protect individuals and prevent it from progressing to active TB. A downside to treating tuberculosis is the fact that you have to take medication every day for so long, and people could easily miss a dose or forget about their medications to throw off the whole treatment process. Also, some side effects includes fever for 3 or more days, pain in the lower abdomen, itchiness or a rash, nausea, vomiting, or no appetite. There's only one vaccine for tuberculosis, and it is unreliable in preventing the most common forms of TB. It is not suitable in all patient groups. The vaccine works best against specific forms of TB, and it is usually given to infants in at-risk populations. Researchers from the Royal College of Surgeons in Ireland are doing research on a new preventative treatment for tuberculosis. This treatment includes using an inhaler, which works by reducing the bacteria in the lungs that causes tuberculosis, while also helping the patient's immune system fight the disease. Without treatment, tuberculosis can be fatal.